A very important topic which is actually Lichen Planus. So let's start it. Bismillahirrahmanirrahim. Okay. So basically it is a chronic inflammatory disease of the skin and oral mucosa. Means mostly people say it occurs in the oral cavity, but it also has a signs on the skin. Also, if the patient has lichen planus, it can also occur on the skin. It is a precancerous condition. Okay, like some mucosa, it is also a precancerous condition. Now, what are the etiology? Etiology and what are the causes? You can say hypothesis. So, number one, we will study about immunology. Immunology, how it occurs. So basically, it is a cell-mediated immune response. Cell-mediated immune response, you know that there are two type of lymphocyte. One we have B lymphocytes, the other is T lymphocytes. In B lymphocyte, it is humoral immunity, and in this basically human immune response, and in T lymphocyte, it is cell-mediated response. So basically, what is it is a cell-mediated response that results in a lichen planus, and it mainly contains T lymphocytes, which is CD4 cells and CD8 cells. CD8 cells are also called cytotoxic killer cells. When the disease in advanced conditions, so what happens that CD8 force amount is more than the amount raised. Okay, so what happens, if it is cell mediated immune response, it is lichen planus. Okay, and lichen planus mostly has a higher amount of T lymphocytes and both that type of cells which I have told you, and then when it advances, so that CD8 cells amount rises. Number one concept, alternation of keratinocytes. What happened then, the cells, keratinocytes which produce keratin, they have alternation. There are some changes in them. So when there are changes, so they become antigenic. These changes are antigenic changes in these cells. So what happen, they stimulate an immune reaction. When they stimulate in an immune reaction, so what happen, there the degeneration of keratinocytes occurs. So what you have said, that there is a changes in a keratinocytes, they become antigenic, they stimulate the immune response, and they start a primary reaction which you call degeneration of the keratinocytes. Okay, number second concept, we will coming towards antigen, yeah, super antigen of the um oral microbial origin. So basically, there is a normal flora in your mouth. So basically what happens, they also induce a cell mediated immune response. When they release an immune response, so what happens, they lead to T cells infiltration, and with this they form cytokines. So the second concept, what tells you basically that there is a super antigen of the oral microbial origin. Oh, okay, so they induce a cell mediated immune response. In that immune response, there is increased T lymphocytes, and then T lymphocytes, what they do, they basically generate the cytokine generation occurs basically in them. Okay, so what is, there is a super antigen of which I am seeing basically, it is actually oral microbial origin, due to which they stimulate in a cell mediated immune reaction, and due to which you have T lymphocyte, then T lymphocyte, there is a production of the cytokine. Then you have another concept which is super antigen. This super antigen is basically, we are seeing about a class of antigen. It is actually a group or a class of antigen that have excessive activation of the immune system. Means that these antigens basically they activate immune system very much basically. So due to which there is a non-specific activation of T cells. Means when they select a T cells, or they activate a non-specific T cells. So there is a massive, like you can say massive cytokine release. What they do, okay, so when there is these antigens, what do they actually stimulate the non-specific T cells. Number one, they release the cytokines, okay, and they also do polyclonal T cells activation, polyclonal T cells activation. Okay, and number actually third concept is basically, we have is basically lacanoid reaction. You can read this from your book also. It is basically certain drugs or dental fillings that induce the immune response. It's just that actually. So what till we have discussed in immunology is number one, etiology, in which what happens, there is a cell mediated immune response. Okay, so cell mediated immune response mainly consists of T cells, and matlab both of the T type of cells, CD4 cells and CD8 cells. When advanced, so there is a rise in the CD8 cells. Okay, then there are three concepts. Number one concept was what? Alternation of keratinocytes. The keratinocytes become antigenic, and due to which they stimulate in an immune response. Okay, immune response reaction. And there is a primary reaction, which we can say there is a degeneration of keratinocytes. The second concept is about the super antigen or antigen of the oral microbial origin. So what they do, they induce the cells, they actually stimulate the immune response, and due to which there's a cell infiltration of the T cells occur with the cytokine production. Then there's a super antigen, which is a group of antigen. These group of antigen has an excessive immune system. They cause the non-specific activation of T cells. They also release the cytokines massively, and then there are polyclonal T cells activation. And then the third concept is leukocyte reaction, which is actually due to drugs or any failures. They also induce the immune response. Okay, number one is autoimmunity. Autoimmunity is basically means जो autoimmune disorders basically occurs due to which T lymphocytes and other immune cells secrete interferon, interleukin, and growth factor, which induce the keratinocytes to produce the HLA-DR and increase the rate of differentiation of keratinocytes, resulting in surface thickness in lichen planus. So basically, what happened in this, that the T lymphocytes and other immune cells, means the T lymphocytes, other like macrophages or other like neutrophils, what they do, they actually released interferon, interleukin, and basically growth factor. These things, these three cells like interferon, interleukin, and growth factor. Then what they do, they activate or induce the keratinocytes to produce the HLA-DR. HLA is basically a human lymphocyte antigen. This is basically an antigen of different types. Okay, due to which when T cells and other cells release like interferon, interleukin, and growth factor, so they will induce the keratinocytes to produce this HLA-DR. This HLA-DR do what? This increase the rate of differentiation of the keratinocytes. Keratinocytes will be differentiated, which results in the thickness of lichen planus. So the lichen planus become thick. Autoimmune disorders have the female predilection associated with antibody with hyper gamma globulinemia. So basically, it is more common in females actually, and there is also with associated with antibody with hyper gamma globulinemia. Acha, so when there is a hyper gamma globulinemia, so basically there is an increased production of also with this B lymphocytes. Means your B lymphocytes or you they are also increasing basically. Okay, in the blood. So there's a means that the gamma. Okay. So the gamma globulinemia means that the GABA globin is in more, and it is more in the blood. Okay, so basically you have studied. So what you have studied in autoimmunity you study there are T cells and other cells. They secrete what? Interferon, interleukin, and growth factor. These then they do what? They activate or they induce the keratinocyte differentiation. Okay, they do they increase sorry the, they induce the keratinocytes to produce the HLA-DR, and then they increase the rate of differentiation them, and then due to which there is a technique of lichen planus. Okay, okay, now this is something. So once again repeat with me, there are T lymphocytes, other cells, they release T cell, they release interferon, interleukin, and growth factor. They do what? They induce the keratinocytes to produce or to release the HLA-DR. What the HLA-DR will do? It will increase the rate of differentiation of keratinocytes, due to which, as a result, there will be a surface thickening of lichen planus, and it is more common in women. And with this, they have hyper gamma globulinemia also. Now, immunodeficiency. People who have decreased levels of IgA, IgM, IgA. So basically, it is in lichen planus. So you can learn it with GAM, GAM, whatever. Okay. And IgA and IgM normal concentration may also be found in some cases, but this you can also say that sometime in lichen planus the patient has also the even the normal levels. They have not there are some cases the patient has normal, not all the time they have decreased levels. Okay.